name is Christy Lynch, and I'm the clinical specialist from Partnership for Strong Families. And today we're going to be talking about caring for a child on psychotropic medications. All right. The objectives for today are to develop understanding of what a psychotropic medication is, clarify partner families' rights and responsibilities relating to psych meds, review psych med documents and case management's responsibilities, and provide partner families with an understanding of the process regarding psych meds. So the definition of a psych med in the child welfare world is a little broader than what it is typically. So we are looking at medication that is prescribed with the intention to stabilize or improve mood, mental status, behavioral symptomology, or treat a mental diagnosis. So this includes typical psych meds like antipsychotics, antidepressants, mood stabilizers, but also includes meds that maybe are typically prescribed to treat a medical condition, but are being prescribed to treat and change behavior related to mental health diagnoses. For example, Intuniv is a medication that is typically a blood pressure medication, but it can be used to treat ADHD, so we consider it a psych med. All right, psych med appointments. So Partnership's policy is that our children are only seen by a child psychiatrist or a psychiatric nurse practitioner for psych appointments. This is because we want our providers to be specialized in seeing children specifically. Just like if a loved one had cancer, you would want them to see an oncologist to have the best care. That is why we would like all of our children to be seen by people who specialize in child psychiatry. Every appointment, the family care counselor or case management representative should be attending. You, the caregiver, should attend, and then legal parents must be invited unless their rights are terminated or there's a current no contact order. During the appointment, the psychiatrist is going to talk to all parties and make a recommendation regarding the need for medications. If medications are being prescribed, they are going to complete a 5339 medical report for the medications. I will show an example of that in a moment. And then the case manager will obtain consent from either the legal parent or ask for a court order if the rights are terminated. And then the psychiatrist might order lab work and blood work for the child before the medication is started. So let me show you what a 5339 looks like, just so you know. It is a 6-page document and it looks like this. So the doctor, this will have the child's information and case management information, but the doctor at the appointment will complete pages 3, 4, and 5. So this will be where the medications are listed here in the middle. And then here at the top of this page will be where they indicate if they are recommending labs. And then if they are recommending labs, case management will take that information and make sure those labs are done. And we will get back to this other section in a moment, but I just wanted to show you what it looks like. Then they'll sign, and then that's the last page. And again, we will get back to that in a moment. Okay. So authorization for psychotropic medications. There are really two main types of consent for psychotropic medication. There's an exception being emergency meds, but that is only a temporary form of consent. So I will further explain. Expressed informed consent is when the case manager will obtain in writing the parental signature from the legal parents in order to sign the 5339. and give this written consent, the parents must either attend the appointment or afterwards speak with the doctor about what is being prescribed. And then, as I showed you before, this is the page where they would sign on this line right here, and they would check that they spoke with the doctor and that they consent. That would be one way to give consent. The other way would be a court order. So the case manager would take the 5339 and send it to CLS, Children's Legal Services, and they will submit a motion to the court for a consent for medication. So emergency medications, which are the exception, let's see here. So this is when medications are deemed by the psychiatrist to be needed. Otherwise, there will be a risk of significant harm. Examples of this are when a child is Baker acted and in a crisis stabilization unit. A child is in an inpatient residential program, often referred to as a SIP placement, or the psychiatrist indicates that it needs to just start on an emergency basis because of the risk for harm. So let me show you where they indicate that on the 5339. That is right here where this red arrow is. This is where the doctor would fill out what medications they are authorizing to start right away before parental consent or a court order is obtained. All right. Okay, change of placements. So when a child is placed or leaving your home on meds, what do you expect? When they're coming in with medications, you should expect the case manager to provide you with a lot of documents, one being the resource record, also known as a blue book. There will be a form called a change of placement form that they may ask you to sign. I have an example of one of those as well. Get that. It looks like this. All right. And then they will provide you with the medications and a med log, which I will also show you what that looks like. And this is an important document because this is something that you are going to fill out each time you give the child their medication and you're going to sign. So it keeps a record of when the medication is being administered. All right. And then they are going to tell you about the next appointment, when or where it is. And they will make sure you know who to call in case of emergencies. And when they're leaving a placement, so if they're leaving your placement and going somewhere else, then they are going to ask you to fill out the change of placement form again. And obviously give them the medications. They are going to perform a pill count, which is part of the change of placement form. They're going to take the med log and they will ask you for the next appointment information so they can pass that on to the next placement. All right, so what is your role? It is to ensure each child has proper consent prior to administration of medications. If you have a question about whether or not they have consent, please reach out to case management. And then for any concerns, the second bullet here, notify the case manager of any issues or concerns. Please don't wait for the home visit if there's an issue relating to medication. This could be with the pharmacy or an appointment or just any questions, please ask. And then administer all prescribed medication in accordance with the physician's orders. So just however the medication is prescribed. And then document the medication on the med log every time you administer it. And then the last one is to keep all medication in a lockbox with a key in a separate location away from the child. Okay, so during home visits, what's going to happen is there is one more form that the case manager will bring and complete, usually during the home visit, sometimes during the psych appointment, called a 30-day form. Let me show you what that is. And it looks like this. So you can see they are going to write the child's information. And basically, this is just a form to prompt a conversation and check in about how the child is doing on medication, and a chance for the caregiver and the child to share with case management any concerns, so that can be relayed to the psychiatrist. All right, so review the medication compliance and effectiveness every month. So this is a portion of the 30-day form. And then you're going to be providing the medication bottles so that a pill count can be completed, because that is part of the 30-day form. Um, After that, you're going to sign the bottom once the 30-day is completed. And then you're going to turn in the monthly med log. And then sometimes if a child is leaving your placement, then you will be asked to sign the change of placement form. Things to not do. Do not administer unauthorized medication. Please do not test out over-the-counter medications or holistic remedies. Uh, do not adjust dosage without doctor's approval or consent. Do not put medications in any other container than the one it comes in. And do not mix old scripts with new scripts. And if you have any questions, you can please uh, ask your case manager, or you can email clinical@pfsf.org, or email myself, the clinical specialist, and I will be happy to help. All right, now we're going to talk about Medicaid and services for child welfare. So we're going to go over Florida's Medicaid plans. Title 19 basically states that all children in foster care are entitled to Medicaid. And we're going to talk about the three plans that we have in our areas, which are United, Humana, and Sunshine. And we are primarily going to be talking about Sunshine Health's Pathway to Shine plan. Dental is separate and will either be through Liberty or DentaQuest. So we're going to go over the Pathway to Shine plan, covered services, how CBCs are involved, and how partner families are involved. So studies over the years have shown that children who have been abused and neglected have much greater health and behavioral health needs. So children in the child welfare system require efficient and effective services delivered by providers who understand these unique needs. Having a single statewide child welfare managed care plan reduces the possibility of health and behavioral health services being discontinued during placement changes. So Partnership for Strong Families entered into a contract with Sunshine Health for behavioral and physical health care coordination. And as I mentioned, the benefits of having the statewide child welfare plan, the benefit is that a child can move anywhere in Florida and they can still keep the same plan no matter where in Florida they are living. Another benefit is that all parties are actively involved in the healthcare provider service decisions. And the plan also aims to improve the quality and timeliness of service delivery. Now we're going to talk about covered services. Here are some of the benefits, and the new benefits are highlighted. So for more detailed information regarding the services, please visit the link. For transportation to appointments, Allevi offers a non-emergency transportation service. And to utilize this, the caregiver would contact the number at least 24 hours ahead of time. An adult must accompany the child during transportation. Mileage reimbursement is also available, but must be prearranged up to 30 days prior. Our eligibility staff can assist you with over-the-counter benefits. And then there is My Health Pays reward. So partner families can ask case workers about eligibility for rewards on healthy behaviors. A good thing to remember is that you can use this and earn money that can be used on items at Walmart. For care grants, please ask your child's caseworker for assistance with that application process. There's also a 24-hour nurse hotline you can call for questions and assistance. And if you have a youth in your home that's pregnant, there are pregnancy and newborn services. So for getting services authorized, Sunshine Health requires prior authorization for specific services. The primary care physician must complete the prior authorization forms. Providers must have requested and gotten approval for the specific services before providing those services. Here is a list of specific services that require prior authorization in order for payment to be made. So all out of network non-emergency services require a prior authorization. And for acute and non-acute inpatient facility admissions, a prior authorization must be sent within 48 hours of admission. You can contact member services with this phone number if you have questions about service authorizations. How community-based care CBCs are involved. So each CBC has a nurse care coordinator that works with partner families, case management, and Sunshine Health. The nurse care coordinator is responsible for monitoring the child's checkups, immunizations, medical and dental appointments. And they also work with Sunshine case management to monitor children with serious medical problems or children who may be at risk of having serious medical problems. There is a health risk assessment, also referred to sometimes as the health risk screening, and this is an initial patient history form completed by the nurse care coordinator within 30 days of enrollment. So this form provides a snapshot of the child's medical status and helps provide information that's used for coordinating care and treatment for the child. These are typically completed annually for each child on the plan or whenever there's a significant change to a child's medical status. You may be contacted by a Sunshine Care Coordinator or the Nurse Care Coordinator regarding the health risk assessment. And then care gaps are monitored measures that provide information regarding services necessary to ensure the health and wellness of our children. So care gaps are reported for all kids on the Pathway to Shine plan, including post-adoptions and in-home and non-judicial cases. Nurse care coordinator will review and monitor the care gaps. So behavioral health care coordinators. Each CBC has a behavioral health care coordinator that works with Sunshine Health, and they are responsible for monitoring children in need of special mental health and substance abuse services, such as STFCs, STGHs, and PRTCs. So specialized therapeutic foster homes and group homes and residential placements. The behavioral health care coordinators lead higher level of care staffings that determine the best services needed for the child. And then CBC care coordinators work with the child welfare case managers and partner families to identify children who may need higher levels of care. Sunshine staff also monitors data to identify possibly high risk or high need children, and they share that information with the CBC coordinators and partner families. CBC care coordinators, Sunshine Health staff, and other involved parties such as partner families, may attend the MDT or higher level of care staffings. So what is your role? Your role is to know the name of the child's primary care physician, PCP, and know the office hours and emergency contact information. It's also important to know the child's dental and vision care providers as well. And then knowing the difference of when it is appropriate to contact the PCP for services, or if it is necessary to go to the emergency room for treatment. Um, and then make sure to keep all medical and therapy appointments. And if you are having trouble or unable to facilitate transportation to the appointments, please contact the child's family care counselor, FCC, also known as the child's case manager. So healthcare facts, we believe that every child deserves a healthcare hero. So that would be a PCP who is their main health provider. Every child deserves routine dental care. The emergency room is best used for urgent and emergent needs. However, you can use the 24-hour nurse line for access unless it is truly an emergency. Also, telehealth is a low-stress alternative to the emergency room for non-emergent needs. Here is a list of the CBC employees I just mentioned, which is the nurse care coordinator, the behavioral health coordinator, and the director of clinical services. For any questions related to a child's Medicaid plan, feel free to reach out to any of them or email nurse@pfsf.org. Thank you.